here I have two sawbones that that we will be performing the bunion procedure on. One would be the traditional bunion surgery. I'm going to perform a traditional bunion surgery. The second identical sawbone, bunion sawbone, we will be performing my minimally invasive bunion procedure, which I'm starting to refer to that as advanced minimally invasive bunion procedure. We're calling it AMI procedure, AMI. So, so we're going to go ahead and start the procedure. I will be talking and explaining every step of how the bunion procedure is performed traditionally and through advanced minimally invasive procedure. All right, so we have these two sawbones. One, we're going to perform traditional bunion surgery. The other one, advanced minimally invasive. The incision for traditional bunion surgery could be on the side or it can be on the top. Either way, the incisions are definitely longer, at least 5 times longer than advanced minimally invasive bunion procedure. There are times that the surgeons perform the procedure from the side, and I've seen pictures, before and after pictures, and they take the picture of the after surgery from the top, and you don't see the incision. That sometimes can distract the patients from knowing how long the incision is, because they're seeing the before and after pictures, but the incision is hidden on the side, and the picture of the post-operative visit is taken from the top, so they can't really see how long the incision is. So I'm going to go ahead and make the incision. In this case, I'm going to make it on the side so we can have access to the bone easier, because this is a sawbone. So here's the incision. So the incision usually is made down to the bone, and the skin is reflected, as you can see, to the side, and the soft tissue, it's also reflected on either side, so that way you gain access to the bone. This is all traditional bunion surgery. As you can see, the incision has to be long enough so you can have access to this bump of bone, which we call a bunion. So for the purpose of this video, I'm going to take everything off here. I just wanted to kind of demonstrate what the incision looks like and how we gain access to the bone. So now we're going to put this to the side, and we're going to bring the other bone, and I'm going to show you the difference between the incision. So the incision for advanced minimally invasive bunion procedure is usually done right before the bump of the bunion. So it's done right in this area, and the incision is about this big. I'm going to go over it again. It's about 1 centimeter. So that's the incision for advanced minimally invasive bunion procedures. You can see the difference. The incision for advanced minimally invasive, the incision for traditional bunion surgery. This incision for traditional bunion surgery could be on top as well. So that all depends on the surgeon's preference where they want to make the incision. So we're going to go back to the traditional bunion surgery, and I'm going to take everything off so that way you can visualize what's done on the bone without all these tapes, and so that way you get a better picture. So I'm going to take everything off. Okay, so next step after we make the incision in traditional bunion surgery and we reflect the skin and the soft tissue back, first thing we do, we cut this bump off. So I'm going to go ahead and do that. Okay, so we usually toss this, so that goes away. And the next thing we do in traditional bunion surgery is we make a chevron cut. There are different ways of doing it. Most often the surgeon does a chevron cut, which is a V cut, basically in this fashion. I'm gonna take a pin and show you how we usually mark the bone. So that would be a chevron cut. So let's go ahead and do that. So that's one arm, which is the top portion of it. And then the other portion would be here. Like so. Once the bone is completely released, then what the surgeon does, it relocates or translocates the bone to a better position, which is most often going towards the second digit. And then we stabilize this with a K-wire or a screw. Most of us do that. So I'm going to go ahead and do that. And once that's done, as you can see, the bunion has been reduced. Then we cut the excess of this K-wire or screw. Most often nowadays everyone is using a screw, but for the purpose of this video we're using a pin. Once that's done, then the surgeon decides if they need to do a lateral release, which is a soft tissue release of the outside of the joint, which is the part that's really tight in any bunion deformity. This is the surgeon's preference if they want to release that tendon or the ligament. Once that's done, the remaining of the bone that's sticking out, as you can see in this area, that's shaved again. So go ahead and do that. Once that's done, this piece also gets tossed, and as you can see, this will be our bunion procedure. At this point, the soft tissue envelope is put back together, which is the soft tissue underneath the skin, such as cutaneous fascia area, periosteum, which is the covering of the bone, gets put back together, and then the skin is closed. Another point that I wanted to make is that when you make a big incision from here all the way down to here or from the top, you are exposing the joint. You have to expose the joint in traditional bunion surgery. Once the joint is exposed and you're putting everything back together, you're creating a lot of scar in this area. That is why sometimes patients lose range of motion, because this area has been invaded. By the time the soft tissue and the skin close, it creates a scar tissue. In some cases, the range of motion is reduced at least 10, 15, 20 degrees. So this is a traditional bunion surgery. As you can see, it's very invasive, lots of bone cuts. Some of the bones, as you can see, was cut and moved out of the body. And in some instances, the head of the metatarsal is reduced by at least 5 to 10 millimeter from the so the area of contact of the toe to the first metatarsal in traditional bunion surgery sometimes is reduced. There's less contact because the head of the metatarsal had to be resected. So these are the two pieces of bone usually we toss in traditional bunion surgery. And this is the end result, as you can see. All right, so we're going to be moving into our advanced minimally invasive bunion procedure. As we talked before, and the entire procedure is done through this incision. Most often, I either use a burr, such as this, or for the most part, I use a technique called the multiple drill hole aneosteotomy. What that means is that you make multiple holes with a small K-wire such as this into the bone in every direction, and kind of plan your osteotomy plane. Once those holes are created, then you can introduce a small osteotome. This is not an osteotome, but it would be similar to this, and introduce it into the same area and utilize a mallet or a hammer and cut the bone with that. So I either use a multiple drill hole with a K-wire and an osteotome, or use a small burr. There are some very small saw blades that I've used in the past, but they're not very strong. I tend not to use those as often. The reason you cannot use a regular saw with advanced minimally invasive bunion procedure is, as you can see how big this saw is, and once it starts oscillating, it even requires more exposure. So you will never be able to use a saw like this on an advanced minimally invasive bunion procedure. The incision is just too small to use this. It will cut through the skin and damage a lot of tissue. Okay, so let's perform this procedure. I'm going to perform this procedure with these pretend skin and soft tissue on, and then we're going to take this off and look at our procedure, how it was performed. So here you go. At this point during surgery, I will be constantly looking at the fluoroscopy, which is the live x-ray, to see where I'm cutting. So here you go. Okay, once the bone is cut, then you can see it's more mobile now. Then I can easily put a jig to something that I have. I will introduce a jig that it's been made for this procedure and push the segment of the bone into a better position, like so, as you can see, and then fixate the segment of the bone through the skin with a K-wire or a screw, and then we're done. There are times that I also do a lateral release, which is something we also do in traditional bunion surgery, but I do that percutaneously. What that means is I would make a small hole into the skin right next to the tendon and release the tendon, like so. So just introducing this, just introducing the knife or scalpel and releasing the tendon that is pulling the big toe to that side. So as you can see, with a small incision and a burr or a K-wire and osteotome, you cut the bone and everything gets shifted to a better position and you fixate it. So once I have the bone in the position that I want, then I usually introduce a wire or a screw from the bottom of the bone like so, and as you can see, my bunion is corrected and my incision was not bigger than 1 centimeter. And that's exactly how I perform the advanced minimally invasive bunion procedure. There was no long incision on the side or on the top. The soft tissue was not invaded. The tendons, ligament, veins, artery was intact. It was just a big shift in the bone, moved to the correct position. We did not reduce the size of the head of the metatarsal, where in traditional bunion surgery, that's usually cut. Everything stays intact. The bone is realigned. There was no need to cut that bump. And this usually takes me around 15 minutes, maximum 20 minutes to do. Patients do very well with this procedure, and in a few weeks they return to get the K-wire or the screw removed, and the bone healing is a lot quicker than the traditional bunion surgery. The swelling is a lot less and the pain is a lot less. Most of my patients with this procedure are walking the next day. We will be talking about all the post-op cares and all the other points in another video. This video was mostly just the procedure. Okay, so we took the skin off to kind of give you a better visualization of what happened under the skin. Obviously this is a sawbone and the burr can just go anywhere. There was not much control with the burr, but usually this bone is cut straight across. We call this a transverse cut. The bone is put into a better position. The bunion is reduced. And then, as you can see, we did not cut any excess of the bone. This area will heal. This area will heal. I will be talking about X-ray findings in future videos to show you how this bone heals and go over everything also on a live person, meaning pictures that I've taken for patients before and after, and also the X-ray findings, how the bone starts healing in week 1, 2, 3, 4, all the way up to week 8. So as you can see, the big difference: small incision, correction is done, and traditional bunion surgery. The results are very much the same. The long-term results are very much the same, and the recurrence rate is very much the same. This procedure is as powerful as a traditional bunion surgery, as you can see, with less pain and less invasiveness, and faster recovery, and a lot of mobility right after surgery.